يا أسامة كنت خش بحساب عزة ولا شو؟ يا قاعد
نمنظر اللي كتب الكتاب ده.
محمد
أحمد عبقر
Yes.
كيفك؟
Assalamu alaikum, everyone. So today we will have a good meeting, hopefully, inshallah. So Dr. Azza will lead the meeting, and Dr. Osama will discuss some of the basics of dementia. It's a big topic, and then we will follow up with some mock interview. So Azza, when you are ready, you can take over. Thank you.
Thank you, Dr. Nader. Hello, everyone. Welcome to our meeting, and I hope everyone is having good time and doing well. And our meeting agenda, as we said before, today we are going to present the dementia presentation. Is presented by Osama. It's very useful presentation, very informative for dementia. And whoever interested in neurology and internal medicine in general will make a big benefit of this presentation. And Dr. Ali Alamin, we will have a mock interview today after we are done with the presentation. So let's start. And Osama, if you're ready, you can share your screen.
Do you hear me? No?
Yes.
Assalamu alaikum. Today I'm going to discuss with you and to share with you some idea about the dementia. And dementia is a big topic, and it is related to geriatric because most of the people of dementia are older people. So we start with the objective. Know and understand dementia first, the risk for and the causes of dementia, the evaluation of patients with dementia, how to plan behavioral and pharmacological treatment strategies to minimize personal, social, and financial impact of dementia, and how to refer patient and caregiver to how to refer patient and caregiver to dementia, or I don't know how to get rid of this. How to refer patient and caregivers to available community resources. Topic covered etiology and social impact, risk factor and prevention, assessment method, differential diagnosis, treatment and management, and then resources. These are the topics that we will be covered today. What is dementia? Dementia is an acquired syndrome of decline in memory and other cognitive function sufficient to affect daily life in an alert patient. So it is usually progressive and disabling condition. It is not an inherent aspect of aging. So it is not inherent condition like due to aging. So it is different from normal cognitive lapses. So there is many subtype of some sort of cognitive behavior, and dementia is not like normal cognitive lapses, which is considered like mild dementia, or it is not considered as dementia. The epidemiology of Alzheimer disease. 6 to 8% of people aged 65 have Alzheimer dementia, and nearly 30% of those above 85 have this condition. So the older you are, the most likely to have Alzheimer dementia. So it is 30% for people over 85.
Excuse me, Osama, if you could do it at the slideshow, because yeah, this will be better.
So risk factors for dementia. They are definite risk factor and possible risk factor. So the definite risk factors that mean like the major category of risk factors that affect dementia or most likely to have dementia. These are age, Down syndrome, family history of dementia, and those people with ApoE4 allele. Other possible causes may cause dementia, like head injury, fewer years of education. So as you know that your brain, you have, if you don't use it, you will lose it. So that why fewer years of education may lead to dementia. Late onset of major depression and cardiovascular risk factor. As you know that vascular dementia is one of the risk factors. Possible protective factors. There are some factors that may affect dementia positively, such as non-steroidal anti-inflammatory drugs, antioxidant, statin, physical activity, and intellectual activity. These are protective factors for dementia. The genetic of dementia. So we have mutation of chromosome 1, 14, and 21. These are associated with rare early onset of familiar form of dementia before age of 60. So before age of 60, it is related to chromosome 1, 14, and 21 mutation. Protein E4 on chromosome 19, that will lead to late onset Alzheimer dementia. ApoE4 allele increase the risk and decrease the onset age in those related fashion. And ApoE2 may have a protective effect. Assessment and history. Ask both the patient and reliable informant about the patient, because most of these people cannot remember anything. So you have to get the information from the informant, like relatives, and from the patient too. You have to ask about current condition, medical history, because as you know that there are many risk factors for dementia, like vascular dementia, and other diseases like depression and so on. Current medication and medication history. So some medication may affect the course of dementia. So you have to know about the drugs that used, pattern of alcohol use and or abuse, and living status of the patient. Assessment, physical examination. You have to examine the patient thoroughly, neurological status, CNS examination, mental status, and functional status. This include quantified screen for cognitive function, many mental exam, and many cog exam. And then you have to do neuropsychiatric assessment test. Assessment and laboratory. As you know, there is some overlap between medical condition, other medical condition with dementia. So you have to do some investigation to rule out any medical conditions that may affect the dementia or may be on the differential diagnosis of dementia, like blood chemistry, CBC, liver function test, and urine analysis. And you have to do some serological tests such as RBR, thyroid function test, vitamin B12 level, and folate level. Sometimes you need to do some brain imaging to consider imaging when you have onset of dementia less than 65 years of age. Symptoms have occurred for less than 2 years. So because dementia is a gradual disease, so if it is rapid, so you have to investigate by doing brain imaging. Neurological sign and symmetric neurological sign, or if it is symmetric or focal or generalized, you have to do neurological sign. Clinical picture suggests normal pressure hydrocephalus because the component of normal pressure hydrocephalus, I think it contains dementia and gait abnormalities and urinary incontinence. So you have to do imaging study to know if it is normal pressure hydrocephalus or it is dementia or Alzheimer dementia. Patient has had a recent fall or other head trauma, you have to exclude any head injury before you are going to consider it like as Alzheimer disease. Consider non-contrast CT of the head, MRI, and PET. Differential diagnosis of Alzheimer dementia, it is a long list, normal aging, so it may be mixed with dementia, mild cognitive impairment, delirium, depression, Alzheimer disease, vascular dementia or multi-infarct dementia, dementia associated with Lewy body, and other alcohol, Parkinson's disease, Pick syndrome, frontotemporal dementia, and neurosyphilis. So you have to consider all this list, and you have to do some blood tests and imaging study to exclude other causes that mix with Alzheimer dementia. First of all, we have to talk about normal aging. Usually it is not consistent, progressive deviation of testing of memory, of memory. There is some decline in processing and recall of new information. So it will be like slower or harder to recall the information. Reminder work, visual tips, notes. Absence of significant effect on adult daily activity. So you have to assess adult daily activity to know if it is normal aging or it is Alzheimer dementia. Mild cognitive impairment on the differential diagnosis. This is a memory problem without a deficit in other domains. So there is no functional impairment and 12% per year progression to Alzheimer disease. So sometimes it is overlap with Alzheimer. So 12% of people progress to Alzheimer disease. Delirium and dementia. So sometimes they are overlapping. Dementia and delirium often occur together in all hospitalized patients. The distinguishing sign of delirium are acute onset, so it usually acute, cognitive fluctuation over hours or days, so it is very rapid, impaired consciousness and attention, and altered sleep cycle. So these are symptoms of delirium. So it is acute onset, fluctuation within hours or days, and there is impaired consciousness and attention, and sleep cycle alteration. Depression versus dementia. The symptoms of depression and dementia often overlap. Impaired concentration, lack of motivation and lack of interest, apathy, psychomotor retardation, and sleep disturbance. These are symptoms overlap between dementia and depression. But to exclude depression, you have to go further to assess for other symptoms and signs of depression by dig deep in history of the patient. Depression and dementia. Patients with primary depression are generally unlike those with dementia in that they are demonstrate decreased motivation due to cognitive testing, express cognitive compliance that exceed measures deficit, and maintain language and motor skills. So this is a distinguishing feature. The language and the motor skill will not affect it in depression as in contrast with dementia. Effective treatment of depression symptoms may improve cognition. So that why it is overlap. So if you treat the depression, that will affect the cognitive impairment. Alzheimer's disease, it is gradual onset. Primary memory with difficulty learning new information. This is cognitive symptoms, and this is the main symptoms of Alzheimer's disease. It is primary memory with difficulty learning of new information. Motor symptoms rarely early, apraxia later. Progression, it is gradual, usually over 8 to 10 years on average. So if it is rapid, you have to consider other differential diagnosis such as delirium or depression or other like vascular dementia or multi-phase dementia. Lab test will be normal in the Alzheimer's disease. Imaging study, possible there is a global atrophy. And a small hippocampal volume. So this will find it on the MRI or the CT scan. Small hippocampal volume and possible global atrophy. DSM-4 diagnostic criteria for Alzheimer's dementia. Development of cognitive deficit manifest by impaired memory, aphasia, apraxia, agnosia, disturbed executive function. Significantly impaired social occupational function, and usually it is a gradual onset, continuing decline, not due to CNS or other physical conditions such as Parkinson or delirium, not due to an axis 1 disorder such as schizophrenia. Vascular dementia is one of the differential. Onset may be sudden or stepwise. Cognitive symptoms depend on the anatomy of the ischemia. Motor symptoms correlate with ischemia. Progression, it is usually stepwise with further ischemia. Lab is normal usually, and imaging study show cortical or subcortical changes on MRI. Development of cognitive decline manifests by impaired memory, aphasia, apraxia, agnosia, disturbed executive function, and significantly impaired social occupational function. Focal neurological symptoms and sign of evidence of cerebrovascular disease. So most probably these people have like a stroke or other TIA or cerebrovascular diseases. Deficit occur in absence of delirium. Lower body dementia, gradual onset, memory, visual-spatial hallucination, and fluctuation. These are the cognitive symptoms of Lewy body dementia. Motor symptoms, Parkinson or Parkinsonism. Progression usually gradually, but usually faster than Alzheimer dementia. Lab usually normal, and imaging study possible global atrophy. Frontotemporal dementia. This is gradual onset, usually at age less than 60. Cognitive symptoms, executive, disinhibition, apathy, behavioral changes. Motor symptoms, usually none, and may be associated with ALS in rare cases. Gradual progression, but faster than Alzheimer dementia. Lab test, normal, usually. Imaging study, atrophy in the frontal and temporal lobes. Regarding treatment, primary goal of treatment to enhance quality of life. So you can say that there is no like definite treatment, but you have to work on quality of life and maximize functional performance by improving cognition, mood, and behavior. So it is like symptomatic treatment of cognition and mood and behavior. So non-pharmacological management, cognitive rehabilitation, individual and group therapy, physical and mental activity, regular appointment to follow up for any changes or any improvement or deterioration in the patient condition, family and caregiver education and support, environmental modification. Regarding pharmacological management, treatment should be individualized. So some people benefit from cholesterol inhibitors such as donepezil, ravistamine, and galantamine, minamethine, and other cognitive enhancer, antidepressant, psychoactive medication. So the main treatment is cholesterol inhibitor and cognitive enhancer, and antidepressant if there is symptoms of depression, psychoactive medication if there is any symptoms of psychosis. Cholesterol inhibitors, the mechanism of action, it is a slow breakdown of acetylcholine. As you know that these people have low acetylcholine. So by slow down of a breakdown of acetylcholine, you will there will be enough acetylcholine to function. Clinical trials demonstrate modest delay in cognitive decline compared with placebo. GI symptoms effect is common. No evidence of differences in efficacy among other drugs. We maintain neuroprotective effect is to reduce glutamine-mediated excitotoxicity. Modest benefit on cognition, adult daily activities, and behavior. FDA approved for moderate to severe cases of Alzheimer. Common adverse effect, constipation, dizziness, and headache. Symptoms management, sundowning, psychosis like delusion, hallucination, sleep disturbance, aggression and agitation, and hypersexuality. So these are symptoms. You can treat these symptoms, each one by specific drug like psychosis, psychosis or sundowning. You can use antidepressant. The sleep disturbance, you can use some sleep aids, and so on. Resources for management of dementia. Specialist referral to geriatric psychiatrist, neurologist, and neuropsychologist, social worker, physical therapist, and nurse. Resources for managing dementia, attorney for wills, conversationship, and estate planning. So you have to get like attorney for will for any patient to know exactly what they need. Community, neighbor and friend, aging and mental health networks, adult daycare, respite care, and home health agencies. Organization, Alzheimer Association, and area agency on aging, counseling on aging, and services, meal on wheel, and senior citizen centers. In summary, dementia is common in all adults, but is not an inherent part of aging. Alzheimer's dementia is the most common type of dementia, followed by vascular dementia and dementia with Lewy body. Evaluation include history with informant, physical and functional assessment, focus lab, and brain imaging studies. Primary treatment goal: enhance quality of life and maximize function by improving cognition, mood, and behavior. Treatment may involve both medication and non-pharmacological interventions. Community resources should be used to support patient, family, caregivers. So we have like a couple of cases, so we can go through each one. Here is a 72-year-old retired bookkeeper. Is brought to the office by her husband because she had a gradual increased problem with her memory over the past year. First, she had trouble remembering the name of new acquaintance, then difficulty recalling detail of books they read together, and more recently, she had to telephone him for help because she could not recall where she had parked her car. Last month, the husband had to take the control of managing of household finance, a job she had performed competently throughout their marriage. So Alzheimer's disease is diagnosed after physical examination and evaluation, including lab tests and structural neuroimaging. And they ask about cholinesterase inhibitor. So here is a question: which of the following statement is the best response for this question? Cholinesterase inhibitor treatment. It is the most common adverse effect event, and headache or somnolence. Liver function test must be monitored for the first 6 months of treatment, or improve improvement of cognitive symptoms is sustained during the first 5 years of treatment, or benefits are likely to be clinically subtle, or cholinesterase inhibitors differ significantly from one another in their effectiveness. So the answer for this question for cholinesterase inhibitor is benefits are likely to be clinically subtle. Case number 2, 68-year-old man is brought to the office by his wife. His wife
just give if some people would like to answer before
okay.
You give their answer. So
okay,
so let like our brain work for a little bit.
okay then.
Okay.
68-year-old man is brought to the office by his wife. His wife reports a 9 months history of increasing problem with saying what he wants to say. And the patient agrees that he often knows that he wants to say, but has difficulty getting the word out. And the patient, a college graduate, recently retired from an accounting firm. He has no trouble driving, maintain his investment profile, and enjoy cooking in the kitchen he had remodeled 6 months earlier. History include dyslipidemia controlled by diet and mild hypertension for which he takes thiazide daily. On examination, the patient is fully oriented and demonstrate normal memory on screening test. He named 8 out of 10, beginning with letter S in 60 seconds, and he struggled to copy intersecting pentagon. The remainder of neurological examination is non-focal. Neuropsychiatric testing show moderate impairment on Boston naming and clock drawing test. Lab with a normal limit. Non-contrast CT scan of the head, mild periventricular white matter disease, and lacunar infarct in the left basal ganglia. So the question is, which of the following is the most likely diagnosis? Is it vascular dementia, mild cognitive impairment, Lewy body dementia, or frontotemporal dementia, or Alzheimer dementia? If we go back here, non-contrast CT scan of the head, there is mild periventricular white matter disease and lacunar infarct in the left basal ganglia. So the diagnosis will be, anyone can share?
I'm sorry, I have a question, please.
Mm-hmm.
Is the dementia gradually progressive or rapidly progressive?
So for Alzheimer dementia, it is a gradual progress, and it take like long time, so almost like 6 to 8 years. So if it is less than 2 years, you have to consider other causes of dementia, like depression, vascular.
I mean, in this case, I'm sorry, I did not hear the question properly. The patient progressed quickly or gradually?
Okay, for this one. His wife said that he reported 9 months history of increasing problem with saying what he want to say. So it is almost like less than 1 year. So this is like you consider it like rapid. Even if it is less than 2 years, it is considered rapid. So it will not be Alzheimer dementia in this case, because it needs like 6 to 8 years to consider it.
I'm sorry. Does he have focal neurological deficit?
Delirium, vascular dementia, because it is stepwise dementia, and so here, which of the following is the most likely diagnosis? Vascular, mild cognitive, Lewy body, frontotemporal, or Alzheimer dementia?
I'm thinking about vascular dementia, but I want to make sure he had focal neurological deficit or motor or sensory neurological deficit.
No,
No,
not,
he
not
didn't
in
have,
the, not
because
mentioned.
on neurologic examination,
Because there is MRI, there is features of brain infarction in the MRI.
that's why it is not a vascular dementia. So if you see this case, it is not like dementia. It is not like Alzheimer dementia because it is short term, and there is no like excessive impairment of memory, or he may miss the name, and he miss some other things that he can do. This is
Mild cognitive,
mild form of
cognitive
dementia,
impairment.
I think. So the answer is mild cognitive impairment. The third one, 78-year-old man comes to the office because he recently fell for no apparent reason. He had no cognitive problem for 5 years. At first, a friend noticed that he often seemed inattentive and was easily distracted. He began having trouble navigating to the location of his poker game and held at a different person house each month. The patient's family noticed that he was intermittently confused and often talk of seeing a different friend deceased at his house. He is no longer able to organize his social calendar or prepare tax refund, which he previously did with ease. The family believes that recently his memory has begun failing as well. The history suggests dementia with Lewy body. So the question is, which of the following statement is most accurate about dementia with Lewy body? Clinical suspicion is increased if Parkinson was present more than 2 years before the dementia. A history of exposure to neuroleptic agent with no adverse event excludes the diagnosis. Occipital lobe hypermetabolism is seen on BET. Associated visual hallucinations are usually complex and vivid. So most probably hallucinations are usually complex and vivid in Lewy dementia because it has visual hallucination, dementia, and what is the other third? Cognitive impairment, I think. Okay, that is all. And,
Parkinson's disease.
Parkinson's disease, yeah. If anyone has any question, please feel free to go ahead and unmute yourself.
Yeah, usually Parkinson's symptoms appear later after the dementia.
Yes, yeah, right. Yep. Any question, any suggestion, any addition?
Thank you for the presentation, and we'll wait for the questions. If anybody had a question or comment.
Thank you so much, Dr. Osama, for the great presentations. This is really concise and to the point. Hopefully this will help you guys when you see patients in your practice. Thank you.
All right, so if there is no questions, we can proceed to the second part, the mock interview with Dr. Ali. Are you ready, Dr. Ali?
Yes, I'm ready. I should be ready.
You look ready. All right, so the interviewer, I believe I didn't get the name of the interviewer, so if anybody was assigned for this, or I can interview you if there is no one.
Okay, you can go on.
Yes. Okay.
Hello, Azza.
Yes, Lubaba. Are you the
I'm
interviewer?
just suggesting, like, how about a panel interview? Like more than
Oh,
one
that
ask
would be
Ali.
great. Yes.
Yeah. So go
Yes.
ahead and start. I will hop in.
Thank you,
And,
Lubaba.
okay, yeah.
All right, so
You
you'll
are
be
in the
our
spot,
program
Ali.
director. All right. All right. Okay, I will go ahead and start. Thank you very much, Dr. Ali, for coming today for the interview. And we'll start our interview by just let us, well, I want to know a little bit about you.
Okay, thank you for having me. I would like to show my sincere gratitude in regard to this interview invitation. My first name is Ali. I was born and raised in Sudan, a country in Africa and Middle East, to a typical middle-class family. My parents were very keen about our education. They gave us their support, attention, and focus in order to fulfill our academic achievements. I had the opportunity to join the University of Khartoum in 2007 after being ranked one of the top 100 students in Sudanese university entrance exams. And then after graduation, I had the opportunity to work as an internship doctor in different medical fields. At that time, I have thought about medical training in United States from my older brother. He is already a physician in America here, but I was not able to travel to America at that time because of family issues. Later, I traveled to Saudi Arabia. I worked there as an emergency medicine doctor in a governmental emergency department. And I managed to finish my USMLE exams. And later on, I got married to my wife. She is already a resident here in Michigan. And I traveled with her here via the J2 visa. Right now, I am doing an online research fellowship program conducted by Michigan State University Department of Geriatric Medicine. And I am planning for sitting for USMLE Step 3 exam in a couple of months. Generally, I have always been described as an extrovert person with open personality and easily approachable man. And I like reading books, especially books about politics, history. And I like going outwards with friends, family members in outdoor activities. I have heard a lot about the residency program in your facility from the website and from friends. And I think I will enjoy my time here in the upcoming years of my life.
Thank you very much, Dr. Ali. That's impressive, and it's great that you worked in your country and now you came to the United States, so you want to pursue a residency here, as you mentioned. So, Dr. Ali, if you selected for the position of internal medicine residency at our program, what do you feel that you can bring to our program? What is unique about you? What makes us excited to have you on our team?
Okay, thank you for asking me this question. I think in regards to my profession, I had the unique opportunity of practicing medicine in two different health systems. As I have said, I have practiced medicine in Sudan as an internship doctor and as a general practitioner for 2 years. And then I traveled to the Gulf countries, Saudi Arabia, and I have practiced there as an emergency medicine physician as well. I think this gave me the exposure to different health systems, to different environments, and it for sure supported my clinical experience, my knowledge, and my contact with different kinds of patients. In Sudan, for example, most of diseases are tropical country diseases like malaria, tuberculosis, and these tropical diseases. While in Saudi Arabia, I was exposed to different kind of diseases like diabetes mellitus, rheumatoid arthritis, dermatological conditions, psychiatric conditions. I think this gives me the opportunity to be exposed to different health systems and health experiences, and this will definitely help me in my residency program. Moreover, I have always been described as a social person. Sometimes some people say I am over social person. So I was always been known of creating an atmosphere of fun and friendly environment between staff members, nursing staff, medical officers, and all the medical staff in the unit. So I think I will enjoy and I will try to do my best to create this atmosphere in the unit.
Thank you so much. I forgot to introduce myself. My name is Azza Abubakar. I'm the faculty of this program. My colleague here and fellow panel, Dr. Lubaba. If she has any question for you next.
Thank you, Dr. Abubakar, and thank you, Dr. Ali, for your interest in our program. You had a very impressive CV, and you look like, as you mentioned, extrovert and very social person. We look forward to having you. That being said, what challenges that you foresee when you join a residency program in US?
Thank you for asking me this question. I think I have to expect some kind of difficult beginning time in my residency program because I didn't have the opportunity to do United States clinical experience. I have heard from many friends that starting medical career in America needs some sort of prior experience in the United States health system. So I am planning right now to do some kind of observerships and rotations in Espero Hospital in the upcoming weeks. So I can be familiar with the kind of medical practice in America in the upcoming time. I think this may be the most significant hardship that I may face in my medical practice upon starting my residency. But I am planning to overcome it by arranging some sorts of observerships and medical experiences before the onset of my residency program.
Well, that's great. I'm happy that you're gonna start exposure to the U.S. Clinical experience. You mentioned that you are currently doing a research fellowship, and it seems that it's here in U.S. Can you tell me a little bit about it?
Yes, it's a virtual fellowship, research fellowship program conducted by Michigan State University under the Department of Geriatric Medicine. The program is 1 year program. It's conducted via online Zoom applications. We are assigned to participate in at least one research project in a year. And we also are assigned to attend different lectures in different topics in geriatric medicine, like dementia and neurocognitive impairments and other manifestations of other diseases and complaints of geriatric medicine. And we learn how to work in a team in order to successfully conduct a research, and we will try to publish our researches and papers in committees or conferences in United States of America.
That's great. That's great. This is my first time to hear such a thing. That's really looks like an innovative kind of program.
Yeah.
So are you interested in geriatric? Tell me, where do you see yourself in 5 years?
Okay, thank you for asking me this question. I am planning to work as after finishing my residency program. I am planning to work as a primary care physician. This is because I have noticed that many diseases like chronic diseases like diabetes mellitus, hypertension, rheumatoid arthritis, and so on. These diseases also very prevalent worldwide nowadays, but many people end up suffering from serious complications like vascular complications, neurological complications, just because of poor primary health care of these conditions. I have noticed this in my home country, and I have noticed this in Saudi Arabia as well. So this gave me the passion to establish a career as a primary care physician, at least for 1 or 2 years in my life. So to be in a real touch with those patients and to help my community in protecting and preventing serious complications of these chronic illnesses. Moreover, I am planning to join a geriatric fellowship program later on because all statistics in the right now medical statistics stated that senior population and patients are getting older and older, and these patients, especially in the era of viral pandemics like coronavirus pandemic, need some sort of special care, some sort of special clinical care, special kind of health system. So I'm deciding to go for geriatric medicine to participate in taking care of senior population and older patients, and to help them to have a better health care especially in the upcoming years while we are still suffering from the viral pandemic.
Great, great. That's really thoughtful of you. I agree. Geriatric population are expected to grow in the upcoming years, and they would be lucky to have you as a geriatrician. I will toss it back to my colleague, Dr. Abu Bakr, if you have more questions for Dr. Ali. Thank you. Nice talking to you.
Thank you. Thank you so much.
Yes, thank you, Dr. Tahab, and thank you, Dr. Ali, for being with us again. And it seems like you have a well-rounded CV here. You have like a decent amount of experience in the medical field. So how would you feel if someone in the residency is going to be like your supervisor or your attendant, who is someone worked, maybe he's younger than you, maybe he hasn't had the same amount of the experience like you have. So do you feel like how you going to work in such environment?
Thank you for asking this question. Definitely, I am pretty sure that medical education is a collaborative process. We all need to learn from each other, regardless to our prior medical knowledge. Although I had the opportunity to work as a general practitioner in Sudan and outside Sudan, but I think still I have a lot to learn from my seniors and my supervisors. Especially that I haven't been in a regular, well-conducted training program. So I think I will never spend a time not learning from my seniors or my supervisors. And I think I worked with seniors a lot in my previous medical practice. And I have always shown a intent to learn from seniors and supervisors, and I think this is a habit of me, being easily approachable and a quick learner from my colleagues and from my seniors and supervisors. So I don't think this will be appropriate for me.
Thank you very much. It's good to hear that. Tell me about a time that you worked under pressure, or you have achieved something that is it was challenging to you.
Definitely, I can't go over this question without mentioning the Step 2CK experience. I have been working in Saudi Arabia last year among the viral epidemic with a lot of patients, and I had to prepare myself for my USMLE Step 2CK exam. I used to cover night shifts, and I keep my notebook device beside me, studying while I am between patients and the other during the duty, and studying at home after finishing my duty. And I haven't even been able to take a study vacation to complete my exam. Despite of that, I managed to finish the exam, and I think I scored a good score despite all these difficulties. So I can relate the experience of being under examination condition and being covering a full-time duty in a very tough governmental department. So this is something I have been through it, and I have survived it, thanks to God.
Yes, thankfully, the COVID have took a toll on all of and everybody. So, so can you tell me something that you haven't mentioned in your application or in your ERA CV, something that you can share with us?
Okay, I wanted to tell that I am interested in the extracurricular activities like creating friendships, going with unit members in outdoor activities, in festivals and ceremonies. I think I will keep this in my mind throughout my residency program. And I haven't forget any one of doctors or colleagues. I have worked with them throughout my life. So I think this will be a feature of myself during my residency program.
Thank you so much, Dr. Ali. If my colleague has a question, before we can ask you if you have a question for us.
I think Dr. D is going to ask.
Okay, yes. Go ahead.
Thank you, Dr. Ali, for coming to the interview, and thank you all of my colleagues. So I have only one question here. I feel like your CV is very impressive, but I want to know, like, in your opinion, what's your weakness and what did you do to overcome to your weakness?
Okay, thank you for this question. I had been suffering from some sort of performance anxiety. It's not performance anxiety disorder, but some sort of performance anxiety, more or less an anxiety disorder. I have noticed it from the first years in my medical school. Once we had been assigned to present cases in front of the class and in front of classmates, in front of group of people, including seniors, professors, and teachers. And I used to feel a little bit anxious and a little bit less of my self-esteem. But later, I had the opportunity to join the teaching staff of medical school in Ahfad University for Women. It's a private university in Sudan for women education. And I joined there in a job as a clinical tutor or a university teacher. So I was assigned to teach the students about basic science like pharmacology, clinical anatomy, and biochemistry. And I spent there 1.5 years. And thanks to this 1.5 years, I had the opportunity to thrive over my performance anxiety. This helped me a lot in overcoming this weakness. And I think I have improved a lot since last time I used to suffer from this hardship during my medical school. So I think this may be the most significant part of the most significant difficulty I have suffered in my medical practice.
Thank you for your answer. And that brought me my second question. So it seems like you had experience of teaching to medical students.
Yes.
So did you enjoy teaching medical students?
Yes, exactly. I had the opportunity to teach one of my fellows. I'm sorry.
No problem. Go ahead.
After graduation, I was asked by a group of my colleagues, my fellow medical students, my fellow in medical school, to teach them some courses in internal medicine. This is the first time I noticed my passion towards teaching. So I used to teach them some courses in internal medicine, cardiovascular system, and gastrointestinal system. And I helped them a lot in fulfilling their score in their shelf exams in internal medicine. After that, I joined Ahfad University for Women as a medical tutor in Department of Basic Science. And recently, before traveling to America, I have established like a private institute of medical education in Sudan, in Khartoum. And we used to teach medical students and some doctors who wants to sit for the USMLE exams. And we had the opportunity to help a lot of doctors in fulfilling good scores in their USMLE exams. I think this brought my mind in a very crucial part of any doctor's career. So that medicine is not only about treating patients and alleviating their pain, but it's also about educating aspirants doctor and junior colleagues, and to help them in for better understanding their profession and their to achieve high scores in their exams. So I think this is something I really interested in, and I think I am considering some sort of medical education in my future.
All right. From the overall conversation, I came to know, and from your CV, that you basically had a very diverse experience. You practiced in Sudan, and you also practiced in Gulf, one of the Gulf countries, as the emergency medicine physician. So my question is like, do you think that diverse experience would help you for our program?
Definitely, yes, definitely, because I think in nowadays America is not only for medical practice in America is not only for American. Nowadays, IMGs are a crucial part of American health system. Not only because of their experiences, but also because of the kind of patients. Because nowadays we see a lot of population from outside of America living here, and it's basically a country of immigration. So definitely, bringing foreign experiences from foreign health systems will definitely help us to promote and develop the American health system. So I think this definitely is going to be a very good addition to the residency program.
All right. Thank you so much for coming here, and it was a pleasure meeting you. I wish you
so
all
much.
the best.
Thank you so much.
Thank you so much, Dr. Ali. It was nice having you today. Nice to talk with you. And if you have a question for us, go ahead.
Thank you so much for this very warm interview. I thought this is a real interview. I didn't think this is a mock interview at all.
Yeah, that was the thing.
To be honest, I have not prepared for all these questions. Some answers I have just figured it out of my mind, out of nowhere. Some answers I have already prepared for it. And you performed literally as if you are program directors. So you gave me a very good experience prior to my interview.
Yes, and for me, so I will start by giving you my feedback, okay? And then if Lubaba and Sumi, I bet they have some feedback too. But first, let me say that was excellent, and you did very well. I have few things that I want just to remind you about it. To me, you did great. You carried yourself very well. Your answer was not robotic. It was not something that you were like memorized and you want to just say. You carried your smile the whole interview. That was an excellent thing. Keep that. And just a few things. I needed to hear about your work-related strengths more. I didn't hear anything about how hardworking you are, how are you're efficient, you're resilient, you work under pressure, how professional you are. These words matter. So just bring them in. Whenever I ask you about your strengths, what is more unique about you, what are you going to bring to our program, make sure to put those in there. Like say, I'm hardworking, I'm professional, I'm resilient, I'm flexible, I'm like self-motivated, I'm someone who can like do so and so, and give your example. Your example was great. And tell me about yourself was great too. A little bit lengthy. If you could like take some of the stuff that make them, because you want to keep the interviewer engaged. You don't want them like to tell. They don't want to hear a story. They want to just know the main points about you. Okay. I like that you talked about your hobbies. You talked about yourself outside. That was excellent. And don't give your red flags right away. Don't say, I have a problem with so-and-so. But the thing that you did, which was good, you said that I have a problem with this, and you give the fixation. You have a problem with US clinical experience. That's why you did so and so. Okay. To me, that was good. And use more body language and hand gestures next time. But thank you so much. That was excellent. And I believe you were grilled today.
Thank you so much.
Thank you. Thank you for tolerating. So,
thank you so much.
So if anybody has a comment,
Comments?
Yeah, you can like comment or Sumi.
Yeah, sure. Yeah, from the beginning, very, very good. Yeah, excellent.
Thank you.
I just gonna second what Azza said. You did great. The most important thing I noticed, you were very relaxed. And I can tell your personality from the way you talk. You are very social. You're smiling all the time. Despite that, we surprised you with many questions that I'm 100% sure you're not expecting.
Thank you so much.
Yeah, you were able to keep calm and answering these questions to the best of your abilities. So, and as I mentioned, like I felt like your answers, all of them are very sincere. And so nothing like we're something memorized or you are trying to make stuff that's not in your personality. This is what I felt.
Thank you.
The thing, as Azza mentioned, you have a lot of qualities. I can list number of things from your talk and the way that you answer the questions. Very good qualities, easy going, approachable. You have initiatives, and I noticed leadership qualities too in the way that you talk and some of the story that you mentioned. But to me, I think you did not put those qualities in the right way to show. For me, I guessed all of these, but as I mentioned, you have to tell them. And
Okay.
yeah, so make them within stories. And the other thing that your answers are engaging, but I felt like very long. So
Okay.
just, yeah, work on summarizing
Nice.
the answers. Yeah, but the content is really good and very convincing.
Okay.
If I am a program director, I will rank you high. In addition to
Okay.
your impressive CV, yeah, the important thing that you have the teaching, and you revealed a lot of things about teaching that you did not mention in when Azza asked you, what are you going to bring to us to this residency? So teaching is really a big thing you have to talk about, because you will be working with interns, with medical students, and especially if you're not in a university program.
Okay.
So talk about that, talk about your research experience. You are a geriatric research fellow, and this is an experience that you're going to bring to the program as well. So when I ask you about your challenges that you will foresee in residency, you talked about the US clinical experience, and as I mentioned, you talk about briefly about what is the problem that you are seeing, and this is what you did to overcome this problem. But I noticed that you are always mentioning this is the most significant thing. Don't make it significant. Make it very small and light thing, and you are already working on it. So don't highlight that's really big problem. But other than that, you did really excellent, and I wish you all the best.
Thank you so much.
You're welcome. You're welcome. And don't forget to ask the questions to program directors. We were expecting some questions from you. Yeah.
Okay.
All right.
Sure.
Perfect.
Thank you.
All right.
Dr. Nader? Comment.
Sorry.
I want Dr. Nader to comment on my interview, please.
I will do that. Let's get Sobi and then I will follow. Thank you.
Okay.
Oh, so I wrote my thing. So first of all, yeah, I like the way you are very relaxed throughout the interview, which was like, this shows that you are confident, which is your like good things. But here, as I mentioned, that we are here to grill you today and give her time. So, but
sure.
Course, like I want to say something that you should improve and you can improve. That's why this platform is today. None of we are 100% perfect, but we always have the improvement, room for improvement. So first, I want to mention that like literally this was a three let's say this is a three faculties interview. It's a panel interview. So the interview will be conducted via Zoom. So probably the other, like the way we are today, the setup probably the same way. So after literally all of the questions, you're saying thank you for the questions, which is a good way, but try to reframe it in a different, because it looks, it sounded very monotonous. So,
yeah, you're right.
Yeah, instead of saying after every question that thank you for the questions, or you can say thank you for bringing up this question that reminds me something, that reminded me my my experience as a teaching experience, that's reminded my teaching experience, that reminded my golf experience, something like that. So because they might think that although we prepare all the questions, but we should not show them that these are the, like we just memorize everything. So if you keep repeating the same word, they might think, oh, it's like it's monotonous. So this is one thing. And other thing I want to mention that see, I know I'm sorry that for my personal reason I'm not able to open the camera, but I should, but the thing is, every time just before going to the interview, you should know that who are the faculties you are going to for interview and their name, at least their last name, and you should address by their last name, like I know this was, you don't know, probably me and Lubaba or Raza will be interviewing you, but of course, always introduce yourself, or when we have a question or any faculties. Thank you for your questions, Dr. Dahab, or thank you for your question,
Okay.
Dr. Abubakar, because this is very,
Sure,
very
sure.
important in
Sure.
America, because
Definitely.
I know, we all came from different background, but it's same Asian and African country, but they love, they want to hear that by their last name, like how you adapt American cultures, that shows that. Okay, so this is one thing. Just remember all of their last name, or like how you, and even if you do not know, just see their last name by their like we all have our last name that way, right? So maybe if interviewing even with the chief resident, but you don't know who is the chief resident is going to interview. So as soon as you see who is asking you the questions from the camera, so you from the this platform, you should say like, thank you, Dr. blah blah blah, something. So this is one thing. And other thing is, like you mentioned about, I asked you, like my question was like, how did your diverse experience help in our program? So your answer was generalized for that question. I know you may not prepare for that question, but your experience brought me these questions, right? So because you mentioned you have a diverse experience, but you said like, oh, America cell culture is not only for like, they have like diverse group of population. Yeah, that is right. But I asked about our program. So what I'm suggesting you, just read before, interviewing, like read about or learn about, research about that program, and learn about what's their patient demographics. Like, do they have like Asian population, or like diverse population, or more Caucasian populations, and based on that, you should connect your experience based on that program. Because you understand my point, it's not like, yeah.
Definitely.
Yeah. And the other thing is like your eye contact. I would suggest you to some eye contact rather than like we open the camera. Some even like it may happen, some of the faculties may not open the camera, but your eye contact should be always in the, like in the spot. And also use some hand gestures to answer some questions, which is always like advised from previous resident and, our colleagues. And I noticed that when I was asking you a question, there was a fire alarm. So what no, that's fine. We are a human being, and we are living, and the interview will be again conducted in Zoom, but be prepared for that. It can happen either way.
Okay.
It may happen in my side, it may happen to your side. So, something happen, it is not our control. So even that should, because the other side is a hospital, somebody might get in blue code or something. So what you do, I will suggest like, to make this environment like, normalize. You may say, oh, I'm so sorry that, this uncertain thing happened, but I'm glad that nothing serious or nobody injured, nobody affected. We can move just to make this condition, that you're aware of that. And other, I mentioned that you consistently mention that you learn things from your colleagues, from your seniors, and from your teachers. But please mention that you learn things from your juniors as well, because like we all are kind of like, I won't say like we all are like very fresh graduate and just came from the medical school. So you will be meeting with your colleagues, like who will be junior to you during residency, I'm sure, because American graduates, the Caribbean graduates, they are literally junior to us. So our intention should be, like same thing, like back home culture is we always learn from the senior, but I want you to mention I learned from junior also. So when I'll be joining residency, I'm open to learn, and I hope that I can learn from my senior and my junior, something like that. That means like, you're showing like a respect to your group decision to your colleague or somebody.
Okay. Thank you so much.
I hope that helped.
A lot. Thank you so much.
Thank you both, the interviewer and the viewer. Ali, that's a great mock interview session. So sorry, it's busy here, but can you hear me well?
Yeah.
So you did great as far as your view for the camera, your interaction, your smile, your answers. I think part of it you said you already memorized, but some it came spontaneously. And I think that's what will happen in every interview. You will be prepared somehow, but expect that some questions might not be on the list that you memorize or prepare. So I like the idea that you answered spontaneously. And I would like just to also thank Azza, Lubaba, and Sunni for the input. It's very, very useful. So I want you to look at this video, the recorded session, and try to see how you did and what area you can improve, as they mentioned. So some of the questions you answered, I want you to modify your answer. Let's say if they asked you what's your weakness, and Lubaba or Sumi gave you a way to answer that. So try to practice that, modify your answer, basically. Sometimes, as Sumi mentioned, the body in the camera, your shoulders are there, that's good, but I want you to put your hands as well. So when you answer the question, try to use some way of shape of one hand, two hands, kind of, if you are talking about some part, it makes sense when you practice there. The other thing, try to act, not to be yourself all the time. So, for example, if you have a question that's already you know and you have the answer ready, I want you to act as if you are thinking about the question. Let's say they ask you, tell us more about an experience that, whatever that. So, so you can say, thank you, Mr. Brown, Dr. Brown, and then you make a silence, like a brief, yeah, that you are thinking about what you are reminding yourself of, or something like that. So it's kind of, so
simulation.
Yeah. So basically, you are doing great. I don't think it's just modification of what you said or how you conduct yourself. I wish you all the best, and thank you everyone.
Thank you so much.
For the input. Yeah. Good luck.
Thank you so much.
Thank you so much, Dr. Nader, and thank you, Sumi. Thank you again, Ali. You did great.
Thank you. Thank
as
you.
Dr. Nader, you're welcome. Dr. Nader said you can look back at the video at the end of the, and you can like criticize yourself and just see, I should have done this, I should have said that, I shouldn't have said that. And all the best and good luck for the real interview.
Pray for me. It's just 2 days. In 2 days.
Good luck. You will do great. You will do great.
I hope so. Thank you so much.
Just Ali, I just want to let you know that, you know, it's very easy to find someone's fault, but if I am in your position, I may do more mistakes than you, you know, because you are in like surrounded by now literally 20 people. So, you know, we are all attention to you and yours. So, you know, yeah, but you know, like we all do mistakes, but I'm so glad that Dr. Nadir mentioned that, you know, you can go back and check the video. That's a very
Still there's time for improvement.
Yeah, so you know, you can self-criticize yourself, and you know, based on that you can perform, or probably you can do a mock interview with your wife, as she's a physician. I mean, she's a resident, so you know,
she's busy cooking right now.
Yeah, so you know, so that's I think a good idea to do that, because you know, by that day you'll be like well prepared. But you are 100% like prepared, just to like, you know, like it is better to get more, because I do not know about your CV at all, so it is better to, you know, like I think expose to different group peoples who doesn't know any idea about you. That's how the faculty would be, right? So sometimes it's better not to practice interview with the people you already know. So
I suggest that for the upcoming sessions next week and the week after, the interviewee to submit their CVs for the interviewers 1 or 2 days
Yeah.
before the session. Yeah, this may help in creating questions for the
Yeah, it
interview.
will be more realistic and more interactive. Yes, of course.
Yeah, to be tailored according to the CV.
Exactly. Yes.
Good luck. Thank you. And
Thank
we
you.
are
Thank you.
learning from this session, okay? It's not only for...
Sure. Yeah, for
exactly.
sure. Thank
Exactly. Good luck and thank you very much, Ali. And
Thank you so much.
yes, thank you, Somi, again. So anybody want to share anything, any comment, any question that you feel that is we have left out and it is asked more commonly these days? The Sumi's question, the diversity question is a trendy question nowadays. They're asking more about how you feel about diversity and working with diverse cultures and something like that. Yes, so we all need to practice answering that question more.
Sana has a question or comment. Please go ahead, Sana.
Go ahead. Yes.
Hello, everyone. Thank you, Azza, Sumi, Lubaba. Thank you, Dr. Ali. I need to ask Dr. Azza, please, about the question of the ethical dilemma. Azza, can you hear me?
Excuse me? Yes?
Yeah, I'm asking about the answer for the question of the ethical dilemma.
Ethical dilemma. Okay. Like if you were asked about an ethical dilemma, what is the question is?
Yeah, I mean, what is the answer for the question in the interview when they ask me, tell us about an ethical dilemma that you have?
So the question is, tell us about an ethical dilemma you went through.
Yeah.
Something like that.
Yeah.
Okay. So I believe if they're asked about something like that, they would specify what kind of ethical dilemma, or towards a patient, towards a colleague, or towards your work in general. They would be more specific. But in general, have a small story prepared before you jump right into the answer, like and set your headings, like set your highlights. Like if they're asked about ethical dilemma with a patient or a difficult patient or something like that, you would always say, I would not judge, I would not take things personally, I would try to put the patient's best of interest before anything, and my patient's best of interest is before anything else, and talk with the patient. And but the question has to be more specific. If you find the more specific question, or if anybody else has
Okay, so if I ask Azza, yeah, ethical dilemma with a colleague.
With a colleague?
Mm-hmm.
Okay, so as I said, when you answer such a question, they would, if they ask you if you had a similar situation with an ethical dilemma with a colleague, have a little bit of a story that is ready to give them. But in general, you can say, if I have a problem with my colleague regarding patient management, or if I have like disagreement, you can say disagreement happens, but it's not personal. Like we are all working in the best of interest of the patients. I can talk to my colleague in private. I need to understand their reasons behind their disagreement, and always reach for help if I need help from a supervisor. and you can put it in something like that. And if you have a backup story or you have a story ready, you can say, for example, I have been through a similar situation during my internship rotation. We had a disagreement on patient management, on so and so, and my colleague and I had a discussion, and I had a discussion on privately with him, and so and so, something like that. If anybody has.
Okay, thank you for that, Azza. Just we
welcome.
have usually problem in exactly what is the example for ethical dilemma. I mean, what is the meaning of ethical dilemma? Like treatment
Oh, what is-
disagreement, is it a conflict, normal conflict, or ethical dilemma? Is ethical dilemma is something ethical, or yeah, that's what I mean.
Okay, ethical dilemma is like, for me, like sometimes if you reveal like some of patient's information to someone else other than the one that he wanted to be revealed to, or something like that.
Okay, so for them,
Maybe
it's okay to mention that, for example, yeah, I found someone who is revealing patient information to someone else. Is it okay?
Yes, it's an ethical dilemma. If you revealed patient's information to someone else, or if you find your colleague talking about the patient information to someone else, that's an ethical dilemma, and you need to put that situation and try to focus how you're gonna manage that. That's an example, yes, of an ethical.
Okay, okay. Thank you so much.
If anybody want to, Abu Zer, you're raising your hand.
Yes,
Go ahead.
thank you, Azza. So I have noticed that you didn't ask regarding why you chose medicine as a career, why internal medicine, why our program specifically. I don't know if they are still asking these kind of questions or we don't have to be prepared for that. So if you could
I
tell
believe
us how to.
they are asking these questions. Why internal medicine? Why our program? But those answers are like typically you can like they are very typical, and you can say I like internal medicine because 1, 2, 3, 4, and there is nothing personalized about that question. There is nothing about you personally. You can basically Google that question and Google that answer, and you just rehearse it and say it. But they still, yeah, they can ask you why internal medicine, why our program. So specifically why you need to work, why you apply to our program. So those kind of questions they are asked, but they are very typical, and I believe they are not as personalized as the question we asked today to Ali, but because we just want him to rehearse on the most difficult things he's gonna encounter.
Okay, thank you.
So yeah, go ahead. Yes.
Yeah, so I was trying to say whatever I understand about ethical dilemma. So basically, ethical dilemma, what I understood means like in our work, or like, we should not do anything which shows that I did that for benefit of my purpose. Means like it could be like, ethical dilemma could be with my patient, could be with my colleagues, and whatnot, such as like, for in regards to my colleague, it could be like, oh, I should not say like, I should not say that whatever my colleague did a work, I should not get that credit for myself, or I should not owe that credit, or I should not say something like whatever my colleague did, and then I just try to sell by myself, oh no, I did that. So that can be a one example in between, like colleagues and like your co-worker. That can be an ethical dilemma. And also when it comes to patient, we should not do anything that benefits us or benefit me as a physician, we always think about the best benefit of the patient. So something like, like any available options, like it's like a kind of like a decision-making context, like where I should not violate or compromise the ethical standard. So the ethical standard means like whatever the standard, we should not violate that or compromise that, which will benefit my things. So what can I do? Sometimes it is like this ethical dilemma, probably it's unintentional or it could be intentional. So intentional ethical dilemma is bad, but unintentional ethical dilemma, probably sometimes your intention was not to do that, somehow it happened. So how should we conflict that or overcome that? Whoever in the process, like it could be your, if the ethical dilemma happens with among your colleagues, you should involve all the colleagues and your supervisor or whoever involved in these things, and then try to understand from their perspective, and then come to a conclusion that you did not do it intentionally to violate the law, or to show someone's work to your work, something like that. And if it happens to with your patient or something, patient decision making capacity, if you think that was unintentional, say, let's say like you patient's husband or somebody came to know about the patients, and like by mistake you shared the information, but you did it unintentionally. That was not your intention to deliver that message, but you couldn't recognize that he just asked, and you already by from your unmindfully you already shared that. So to overcome that conflict, again you should include like your patient attendant, your senior supervisor or whoever, that that was not my or even ethical committee, that was not my intention, but somehow unmindfully it did happen. So that's how we should overcome, we should do to overcome this conflict. So that's all I understand. Probably Dr. Nadi can explain better, but this is, I think, as a physician, as a practitioner, like a future physician, we should know that this is a good concept. Thank you.
Yes. Thank you so much, Sumi. Yes, you're right. It's worth mentioning that in the United States, the HIPAA regulation, that is the patient's right, the patient's patient's information are well protected by the HIPAA. So Samah, if you could Google the HIPAA and look at the main things of it, so you can have an idea what's an ethical, what is not ethical regarding patient's care. And
okay,
of course, yes.
Okay, I will do. Thank you.
You're welcome. So anybody has a comment on Samah's question or any other question, or has?
I think we can go to the next part of the meeting.
All right. Okay, so our next part is projects update. So we need to hear about what are the current projects and what are the updates. If anybody has an update.
So we submitted 3 abstracts to AMDA, and some are working to submit to ABS. So I think due date in a couple of days, December 1st. Any questions, anything we should discuss? If not, we can plan for next meeting.
Anybody has a question? All right, we can plan our next meeting. What are your suggestions, guys, for the next meeting? Do you think we can continue on these sessions, the mock sessions, mock interview? Anybody would like to go next or? Yes, okay. Yes, continue on mock. All right. Yes, I think we should, yes, exactly. It's of great benefit. All right, so who wants to volunteer, or we should like leave that? If anybody wants to volunteer, they can put on their name on the WhatsApp group, or if anybody wants to go ahead right now and say, I want to do it next time. All right, so we will leave it on the WhatsApp group. Anybody wants to be the interviewee next week? We can do that next week.
I suggest there is a PowerPoint presentation also about delirium. So I put it for next meeting agenda. If someone or maybe two can talk about delirium, I put the link also for the file. It will be on the app.
Next week is which team? Dr. Nader?
Delirium. The orange team.
Orange team. Okay. All right.
Ali, are you in the orange team? Ali?
Is anybody in the orange team right there?
Sama, Ali.
I'm in the yellow team, not orange. Sorry.
Okay. Sarah, is she here? She's gone. Ali, maybe you are in the orange? No. We can at least for the time being during interview, maybe we can depend on the volunteer basis. So who on the list now in this meeting, who can lead the team or lead the meeting?
Okay.
If we have volunteer or if we have someone who wants to practice presentation. So it's just an optional.
All right. So Lubaba will be the interviewee next week. Good. All right. And of course, if anyone from the orange team or nobody right now from the orange team, we can like discuss everything on the WhatsApp group. And who wants to present next time?
Sounds good. And please let me know.
Sure.
Thank you. So last year, some of you or the previous match residents or fellows, they shared some of their experience and you shared some of your interview experience in these meetings. So in the last couple of days, weeks, any of the present fellows, did you have any interview or did you have any experience that you want to share? Maybe just a couple of minutes.
Okay. Anybody has an experience of interview so far? I didn't receive any interview so far, but hopefully.
I wish you all the best, everyone of you guys.
Yeah. Inshallah. So anybody has an experience so far, so he can share like briefly for 5 minutes or 6 minutes what he got or what kind of interview it was.
My interview is scheduled in like December 22nd. I'm sorry, but
that gives you a good time to prepare.
Yeah, that's how I schedule.
Exactly.
Yeah, because it's hard to with my master's program and everything. So I have break at that time. So I schedule that. But I know that Sarah Elside, she had an interview last week. I don't think she's here, but I think we can contact her and through the WhatsApp, and then we may ask her to join next week if possible, if she is available, and then she can give us some feedback.
Exactly, sure. So
Excellent, thank you. So maybe in a couple of weeks, I would like to suggest for the group who are here or the group who can in the WhatsApp you can distribute. If we need to do something different, let's say we are about 6 months of the fellowship now. Let's evaluate what we did so far, what seems to work for you guys, what seems to not work, any areas for improvement, any suggestions as far as how we can make things better for you or in the future for others. So just think about it and let me know. Maybe we can put some time in a couple of weeks in this meeting to discuss and raise point for improvement, for instance. Thank you so much.
yes. Thank you so much, Dr. Nader. I think this is a great suggestion. It's time for us to sit down and see how things are going and how it's going for everybody with this fellowship. And what do you need to? Okay, anybody has a question? I think I can't see anything. All right.
I would like to add one more suggestion. So maybe also if we can, in a couple of weeks, maybe by the end of the year, I want to know some of your family, members, spouses, kids, and maybe you can put a short video, images, photos, just to have social event, all of us. If that's a thing that we agree on, if everyone is busy, we understand. Thank you.
Good. Yes, that's an excellent suggestion. Thank you, Dr. Nader. Yeah. Yes, I think we welcome that so much.
If I may suggest something.
Yes.
Ali can lead the initiative. Show us your social skills.
Exactly. Exactly.
I totally agree with all of you. Yeah.
Exactly. All right. So anybody has any final thoughts before we end our meeting? Anything you want to discuss? Anything you want to ask about?
One more thing down the road, maybe. There are some fellows from batch 1 who went to Florida to do another fellowship. It's similar to what we're doing. So we want them to give us their feedback, what benefit they got, what other things that they are doing that we can also incorporate in this fellowship. Maybe people can benefit. So maybe I'll invite one of them or both of them. So, yeah. Thank you.
Yes, thank you, Dr. Nader. Yeah, we'll try to reach out to them and if they find time by next meeting, they can join us and shed the light on what their fellowship right now.
And also I was thinking like from the previous year, like our resident Mulham came a couple times. I understand if Marwa or Omnia, if any of them are available, can they come and like just give us some suggestion? Something like that can be arranged.
That would be great also.
Yeah, we hope so. Yeah, we hope so. Mulham has been doing us a big favor.
Oh,
We
I think we are
gonna
literally
be-
abusing him. So I don't want to.
Exactly. We know how busy they can get in their first year, but we appreciate anything like if they can come. It's great support from Mulham that he's able to show up in the meeting.
And also, if we can contact Khalid Abdelgader too. Khalid,
Uh,
Agree, yes.
yeah.
yes. Okay. Yes.
Sounds good. If nothing else, then let's plan for the next meeting. We'll see you next week. Thank you so much, Dr. Raza, and all of you for this great meeting. And I wish you all the best. Have a great day, a great night. Assalamu alaikum.
Thank you, Dr. Nader. Have a great day and great night, everybody. Thank you for being in our meeting today.
Have a good one.
Thank you so much.
Thank you, everyone.
Thank you.
Thank you.
Thank you. Enjoy the
Thank
rest of
you.
the
Thank you all.
Thank you, guys. Have a good night.